Board education must be ongoing. Please take time to assess your work and review your progress based on strategies outlined in the first video modules shared in 2015. Module 1. The board's role in quality improvement and eliminating patient harm. Does your organization have a board-level quality committee and/or a clinical quality committee? Does the quality committee report to the board? Does your organization have a strategic quality improvement plan with clear goals for improvement that use data and benchmarks? Does your hospital or health system have a method for monitoring quality and patient safety events? And are quality measures and patient safety events reported to the board? Does your board have written, well-defined leadership and oversight responsibilities for quality improvement? Are improving quality and patient safety embedded into the strategic plan and planning process? Does your board spend a significant amount of meaningful time and energy discussing quality improvement? Module 2. How boards can be effective in improving quality and eliminating patient harm. What type of governance education is offered to ensure that board members thoroughly understand the importance of quality? Do you recruit board members with a quality expertise in mind? Have you assessed your committee's effectiveness in the past 2 years? Have you identified a quality improvement priority? Does your organization actively look to learn from patient safety events and implement changes based on such events? Does your organization have specific, measurable targets for improving quality and eliminating patient harm? Are these target goals structured to hold leadership and staff accountable for quality performance? Does your board assess and continuously improve quality and safety literacy through education and training? Does your board employ strategies that include hearing directly from patients, helping to put a human face on data? Module 3. The alignment of safety and quality with financial performance. Do quality improvement and efficiency measures play a role in your financial planning? Does quality play a role equal to that of finance within board meetings? Does your organization's quality improvement strategies impact your financial performance? Has your board received education on value-based payment, readmissions penalties, and hospital-acquired condition penalties? Does your board allocate resources for data collection and to support and implement quality improvement initiatives? Does your board have a clear, understood approach to monitor quality that includes a dashboard for monitoring overall performance? Module 4. Boards must collect and review meaningful data to keep pace in a changing landscape. What quality measures does your organization currently collect and report? Does the board review these measures? Has your organization begun moving from the first curve to the second curve? Has your organization implemented strategies that move the organization toward a value-based reimbursement structure? Does your board routinely track quality performance and patient harm in order to improve quality and patient safety? Is your board engaged in asking strategic questions of your organization to assess readiness in moving from the first curve to the second curve? Have the answers been used to help direct your actions? Does your board oversee and ensure that strategies are put into place to help the transition from first to second curve while still improving quality for patients? Module 5. The importance of measuring harm across the board. Does your board know the total patient harm rate within your organization? For the past year, past quarter? Can you state your organization's key strategic priorities in terms of reducing patient harm? Does your leadership and clinical team track, collect, and share reliable quality and patient safety information monthly? Does your board ensure that the various quality metrics used are aggregated into an overall composite rate to track patient safety events? Does your board play an active role in identifying major organization-wide strategies to eliminate patient harm? Module 6. Boards must have a clear organizational approach and process for improving quality. Does your organization have a notification process in place to both track and react to patient safety events? Does your board take steps to learn about and understand all patient safety events, understanding the event and the factors involved and why it may have happened? How does your board reinforce accountability while continuing to monitor outcomes of care? Does your organization have effective quality and safety measures and tracking processes in place to identify when patient safety events occur? Does your board and hospital or health system leadership have an established process for responding to and learning from events? Along with your leadership, is your board transparent about performance? Is your board open to hearing the bad as well as the good examples of patient stories? Module 7. Ensuring clinician engagement is crucial in eliminating patient harm. Does your board hear from clinical leaders frequently? Does your board have at least one physician or quality champion serving on it? Do your clinicians communicate and interact with your board as it relates to quality improvement policies? Does your board ensure that clinicians achieve set quality goals? Does your board have reliable, ongoing mechanisms to communicate with and engage with clinicians about quality? Is your board makeup such that it has clinical competencies that allow the board to track performance improvement? Has your board identified clinical champions within the organization to help improve quality but also enhance clinician support and engagement? Module 8. The importance of a strong quality culture. Has your organization adopted a culture of safety, and has the board taken steps to promote an environment of excellence? Does your board engage management in performance improvement and tie financial incentives to meeting organizational goals? Does your board recognize successes and share lessons learned among all parts of the organization? Does your organization have a clearly defined culture that centers on the patient, emphasizing transparency, reward, and recognition? Does your board oversee the process of assessing the organization's values, policies, and leadership actions against your desired culture? Does your board support a strong safety culture that involves training, education, resources, trust, respect, and a clear set of expected values and behaviors? Module 9. The importance of patient, family, and community engagement in improving quality. Does your organization have methods to engage patients, families, and the community in setting quality goals? Does your organization have an active patient and family advisory council that participates in your organization's improvement efforts? Does your organization work to educate patients and families about their health and their role in quality improvement? Does your board invite patients into board meetings to share both positive and negative stories? Do your leaders engage patients and families to learn about the care process and identify opportunities for quality and safety improvements? Does your board support and encourage engagement strategies that help educate patients and engage them as active partners in their health? Module 10. How diversity in the boardroom can improve quality and eliminate disparities. Does your board reflect the diversity of your hospital or health system in terms of staff, patients, and the community you serve? Does your board measure and understand potential disparities among your patient populations? Does your board ensure that patient diversity and disparities in care are accounted for and considered when quality improvement goals are set? Does your board reflect the patient population and community your organization serves? Does your board set and monitor efforts to reduce disparities in care? Does your board enforce that strategies are clearly set and followed through on by staff? Is patient diversity and disparities in care a key factor monitored when collecting data and setting overall quality improvement goals?